Hello and welcome to Breast Cancer Answers Weekly Google Plus Hangout on Air, where we discuss the latest in breast cancer news. We talk to medical experts and we answer your questions, concerns about breast cancer. Joining me now is not only our medical director for Breast Cancer Answers, Dr. Jay Harness, but we also have Dr. Victoria Mazes, the executive director for the Arizona Center of Integrative Medicine. Hello, everybody. How are you doing today?
Hey.
Great, thank you.
Okay, so Dr. Mazes, I have to ask you, for those who may not know, what is integrative medicine?
Yeah, so the quick answer is that it's the thoughtful synthesis of conventional medicine with other types of medicine, with other systems. But a more in-depth for your listeners would be that it's really healing-oriented medicine that takes account of all aspects of lifestyle, which obviously would include environmental issues, which is one of the things we were going to talk about today. And then it emphasizes the therapeutic relationship between the practitioner and the patient, and it makes use of all appropriate therapies from conventional medicine and also from other systems.
Victoria, Jay here. Could you give an example of the other complementary medicines that you all put in your integrative approach?
Absolutely. So I have many women with breast cancer in my practice, and they come to me and they say something like, I'm going to do conventional therapy. I'm going to do surgery. I'm going to do radiation. I'm going to do chemotherapy, whatever has been recommended. But then they say, what else can I do? And they want to know about nutritional influences. They want to know about mind-body connection and what could be used there. They want to know if acupuncture could be helpful for them, about the whole range of dietary supplements and herbal products that people keep pushing on them. So it really looks at that much wider array of therapeutic options that could be thoughtfully included in a treatment plan.
You know, to use sort of the old analogy of the Wild West and the snake oil salesman, we got people on the internet claiming all sorts of things, particularly natural things, herbal things, all of this. I kind of look at you and Andy Wild as the truth squad.
Well, one of the principles of integrative medicine is that neither do we reject conventional. So conventional is totally apart, but nor do we accept all things from the alternative medicine world. We really want to be discerning. We want to be open-minded skeptics so that we carefully think about, is there a plausible mechanism? What evidence exists? So, for example, for nutrition, there's so much evidence, and yet it hasn't necessarily gotten into the mainstream medical practice. There's some really good evidence, for example, for acupuncture, for treatment of hot flashes related to breast cancer treatment. That hasn't necessarily gotten into broad medical practice. And so it thoughtfully integrates things where there is evidence, where there is good safety record.
Yeah, and centers like yours at the University of Arizona, and now you've got the MD Anderson, many of the other big cancer centers in the country now have departments in integrative medicine. Is that correct?
Absolutely. I think this is a wonderful growing trend that integrative medicine is being broadly incorporated at cancer centers, including ours at the University of Arizona.
Yep, very good. Lisa, did I hear you take a breath there a second ago and had another question, perhaps?
Well, I wanted to elaborate a little bit more about the acupuncture, especially for women who are going through hot flashes. And as soon as you said that, Dr. Mazes, I wanted to be like flailing my hands in the air going, that's me, that's me. And, and what I've learned, and Dr. Harness and I have talked about a couple times is, I take care of my body so much more now after the breast cancer than prior, which I'd like to talk about that too. But here we are, and I'm going through all the fun menopause stuff and the hot flashes. What do you suggest regarding the acupuncture if somebody would entertain doing something like that?
Well, I do think that acupuncture can be incredibly helpful. I have recommended it to many patients. Many patients have used acupuncture successfully. It doesn't mean it'll work for everyone. I suggest that people give it a try. A try doesn't mean one session. It may mean 4 to 8 sessions. If they haven't perceived benefit, by the time they've done 8 sessions, the likelihood is not great that it is indeed going to help. But there are other things. For example, I don't know if you ever used the diaphragmatic breathing. There's been a large number of studies that show that if you can activate the parasympathetic nervous system, and you can do that through slow, deep, quiet breaths, that can sometimes head off a hot flash, and it also can make them less severe.
Isn't it interesting you say that? I'm sorry, Dr. Harness. Go ahead. Go ahead, Dr.
No,
Harness.
I was going to say, Victoria, you and I as physicians, we throw out big fancy words. Parasympathetic. Most people don't know about the
Yes,
sympathetic and
thank you for
parasympathetic.
reminding me of that. So there's two parts to our nervous system. There's the sympathetic, which we sometimes hear spoken of as the fight or flight. The stereotypical saber-toothed tiger, or maybe it's your boss who's just given you a bad review, and we have our heart racing and we're ready to run. But the quieting side is often less well known about. That's called the parasympathetic nervous system. We sometimes refer to it as rest and digest, and it's responsible for the quieting functions. And we still don't fully understand the physiology of hot flashes, but it turns out that some of the physiology is actually quite similar to the sympathetic nervous system actions in terms of increasing heart rate, increasing blood pressure. And the quieting side, the parasympathetic nervous system, is what's activated by breath work, by things like Tai Chi, by meditation. And so those things can help. Now, you're not going to meditate really fast when you're having a hot flash, but you can take a slow, quiet breath, and there is evidence to support its value.
Wow. Now, listen, let me segue. I've traveled to mainland China. Perhaps you have too. Acupuncture obviously has been around for a very long time. Do we have any clues how it works? Is it by stimulating the parasympathetic system, do you think? Or
You
what
know,
do you?
there's still a lot of theories and different ideas about the mechanism in terms of, can it be affecting neurotransmitters in the brain? Can it be affecting pain pathways? I've seen many, many different mechanisms described. I don't think we know for sure.
Okay, very good. Lisa, did you have another follow-up question?
I would just love to jump in here because when Dr. Mazes was talking about the fight or flight, I was, when I do the yoga, which I've been really trying to get more involved
Right.
in, and a little bit of the meditation, and if I'm feeling that tense, and you kind of take the deep breath and you listen to the breath,
Hmm.
it's amazing how all of a sudden the hot flight. I mean, it works. I mean, as soon
Yeah.
as you said that, I'm like, oh my gosh, I've done that before. No wonder,
Yeah.
because then there's other times where you get so wound up, and it's like, oh, here it comes, here it comes, here it comes. But
Right.
then if I can kind of go, okay,
Right.
okay, calm
Right.
down. It's if it comes on, it's not as strong. So thank you for
You're
making me
welcome.
realize that.
It's such a great tool, obviously, because it's totally under your control. So acupuncture, you're going to have to go see someone who's a practitioner. It's going to take time, and there's going to be a cost. But of course, if you can learn to use this kind of slow, deep, paced breathing, then that is a tool that's always in your pocket. Our breath is always with us. It's free. It's always available.
Wow, that's just fantastic advice. Well, Victoria, that's a good segue into one of the main things we wanted to talk to you about today. As we monitor Twitter and the input of our working with the social network, there's a really hot subject is prevention and the environment.
Right.
And I know you and Andrew Wild have published on this. Andy was one of the very first people to talk about the huge negative role of inflammation in our lives,
Right.
trans fats, I mean, just all of this sort of business. I'm going to sort of leave it open a little bit. And when you've been with us previously, you've talked about some important dietary things. Neither you or I know what the cause of breast cancer is, but there are things that are in our environment or things we can do to the environment of our body that can be very, very helpful. So I'm going to
Right.
sort of toss it back your direction now.
Right. So It's a really important question because my belief is that breast cancer is multifactorial, that there are many influences from genes to environment to radiation exposure, all sorts of things that can increase the risk perhaps. And there's much uncertainty. We all know the person who lives to be 110, who's had the worst habits of their life. And then we know people who seem to be, really healthy, vegan yoga teachers, and something bad happens to them. And so,
Right.
there are no guarantees. Having
Right.
said that, we are exposed to a lot of environmental chemicals, and I think that there is much that individuals can do. And so when I'm seeing a patient, I often like to begin with a bit of a self-assessment, which has to do with where are the environmental chemicals in your life. So they can be in food, they could be in water, they can be in personal care products like your shampoo, your moisturizer, your cosmetics. They can be in pollutants that you're exposed to on the job or outside air pollution. They even can be in scented candles. So we do kind of a broad self-assessment. And if your listeners are interested, I have a website where I've listed some of these, victoriamaizesmd.com, and people can find some of these self-assessment questions and also some of the wonderful resources that now exist that can help you reduce the environmental exposures you may have.
Oh, fantastic. Well, first of all, we absolutely want that link, Lisa. So you're there in our Phoenix office. Please share that with the staff that we want to get that link up as a follow-up to today. But Lisa, I heard you take a breath. Do you want to jump in with something?
Well, I'm just thinking too, because, and I was reading the article that Dr. Harness that you had written about the environmental factors. And, Dr. Maizes, I'm just wondering, and I'm sure we all do this, but can you tell our viewers maybe like the top 3 things that we do every day that maybe we could realize to go, hey, you know what, let me stop and read this label.
Right.
Or let me change this oil in my diet, or, or this supplement versus that supplement.
Right.
And subtle changes, but make a big difference.
Right. So I think there are so many things that can be done, but a healthy diet is really critical. What we put in our mouth is one of the things we have the most control over. We can't always control the pollution or the stress, but what we put in our mouth, we can really be thoughtful and make decisions. When you've had a diagnosis of breast cancer, or if you're at high risk, I think it's really important to consider eating organic foods to reduce the pesticides that are in the vegetables, in the fruits, or in the animals that have been raised on conventional crops that have been sprayed with these pesticides. So I do think the food is really important. Our water is really important as well, and you want to be sure that your water is being filtered, and then you want to drink it out of glass or stainless steel, because the plastic water bottles have bisphenol A, and the ones that don't may have this new bisphenol S, which maybe isn't any better. And so we want an inert container like glass or stainless steel or ceramic when we're microwaving. We don't want the plastics. There's a lot of evidence that the chemicals in plastic do leach into the food, and this is just something that we can find ways to avoid.
Oh, fantastic. Go ahead, Victoria. I mean, tell us some of your other thoughts. By the way, I agree with you completely that I think breast cancer is very multifactorial. One of the articles that came out this week is the incidence of breast cancer with distant involvement among women in the U.S., studying from 1976 to 2009. And the focus of this study was on women 25 to 39.
Yes.
And as you know, we don't routinely screen in this group.
Right.
The incidence did go up in a, if I can get statistically significant out of my mouth, way. And by the way, it mirrors my own practice. I've seen more and more women in their late 20s and early to mid 30s with breast cancer and more advanced cancers. What are your thoughts, and what do you share at the University of Arizona as far as how younger women should be screening for breast cancer. And again, I think it's important to emphasize the things you're talking about should start as early in life as they can.
Right. So it's important to remember that there are critical times of susceptibility for breast. Some of it is in fetal life. And I actually just completed a book called Be Fruitful, the essential guide for maximizing fertility and giving birth to a healthy child. And it turns out that fetal life is critically important for setting us up for all kinds of diseases, including cancer. And so before women get pregnant, they want their body to be as clean and free of these environmental toxins, which are hormone disruptors, endocrine disruptors, as possible, so that during the pregnancy, they are not exposing the fetus when the breast is initially developing to any of these chemicals that may set up for later life cancer. The second critical window is puberty, when the breast is developing. And so there may be times in life when it is more important to be really, really clean, so to speak. So for example, we know that if you eat soy foods early in life, while the breast is developing, during adolescence, there's a lower risk of developing breast cancer later in life. And soy has been very controversial. People have, including myself, in earlier years said maybe don't eat soy because it's a phytoestrogen, a plant estrogen. But the latest studies from the Shanghai breast study and also the LACE, Life After Cancer Epidemiology trial, showed that indeed soy is not something that's increasing the risk if it's soy food, not if it's soy supplements, but food. And in fact, for women who were on tamoxifen, it actually reduced their risk. There's a really fascinating study that's coming out now from San Francisco. Dr. Khan basically has been looking at blood samples that began to be collected in 1959. And they are looking at women whose blood was collected and stored between 1959 and 1967, because if we have a woman come in now and say, she has breast cancer, her habits may be different now from when the breast cancer was initiated. And so these blood samples are just a treasure trove of information to be able to learn something about, well, what was the state when they were pregnant, and what is happening now to their daughters and then eventually to their granddaughters.
Wow, 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 wow. How soon will that study be out, Victoria?
Well, some of the information is already coming out. I didn't see a published article, but there has been a press release about it, and it's just really fascinating because I think that it does allow us to, begin to answer that question about how dangerous are these environmental chemicals.
Okay. So one of the fancy words that's around right now is called epigenetics.
Yes.
In other words, things go on in our environment, including the environment inside our body, that can then alter, if you will, how we're functioning down at the molecular level.
Right.
Are you and your colleagues looking at some of these epigenetic issues?
Absolutely. And I think that it's fascinating because it turns out that while your genes are important, they may not really be of greatest importance. We know that epigenetic influences, and this can be as straightforward as, are you having enough B12 and folate in your diet? Because B12 and folate cause methylation to happen, which is the addition of a carbon-hydrogen little bonded molecule. It's amazing what a difference methylation makes across this enormous range of conditions. And so the foods that you eat very much affect the expression of your genes. And that's what I was saying earlier when I talked about the importance of a healthy pregnancy, because what the mother eats is going to affect, does this baby express later in life diabetes, autism, ADHD, depression, obesity, all sorts of conditions we're now being able to link through this fetal origins hypothesis to the environment that the fetus developed in the womb, as opposed to the genetic material of the two parents.
Wow. That's really important. And then, therefore, knowing that gives us an opportunity to modify it, doesn't it?
Absolutely. And I think that it actually is one of the things that empowers us because it's easy to sort of say, well, I have bad genes and therefore I'm doomed, and throw up your hands and give up. And in my belief system and in integrative medicine, we actually believe there's a tremendous amount that individuals can do to improve their health and improve the genetic cards that they were dealt, at birth. And I think this is really important, again, when it comes to cancer. The genes are one factor, and we know that there's an increased risk if you carry the BRCA1 or 2 genes, but it turns out that's only a small percentage of women overall who have breast cancer. Most women don't have any genetic susceptibility. Most women don't even have first-degree relatives. And so it's important from a young age to begin living a healthy lifestyle, which includes a healthy diet and paying attention to your water. And we haven't talked about, cosmetics and shampoo and moisturizer, all of which have these endocrine disrupting chemicals. So I like for the women who I advise to go on to the Environmental Working Group's database. They've looked at over 80,000 environmental chemicals. I'm sorry, over 80,000 products. So your shampoo, your body lotion, your sunscreen, all of these are likely on that database, and you can figure out, is it safe where it's in the 0, 1, or 2, or is it really toxic where it's 7, 8, 9, 10, and you want to avoid using it if at all possible.
Now, where do we find this database? How do we
So
do
it's
this?
called Skin Deep, and it's on the Environmental Working Group website, which is ewg.org, and you could also get to it. It's linked from my website as well.
Okay, and Lisa, after we go off air, we want to make sure we have from Victoria all of these links because I think they're going to be really, really important. The other big news story all over the media in this past week or so was the report in the New England Journal about the Mediterranean diet lowering, heart disease.
Right.
We've known that's been a healthy diet. Victoria, can you elaborate a little bit on what is a Mediterranean diet and what the key
Sure.
components of it are?
Absolutely. So Mediterranean diet is a diet that's rich in vegetables and fruits, rich in legumes, which are, beans and lentils, things like that. Actually includes red wine and is low in meat, especially red meat. There's some poultry, there's fish in the Mediterranean diet as well. So the important thing about this is that it's actually a diet that has a substantial amount of fat, and we like the taste of fat. It's got good mouthfeel. It makes you feel satiated. That means that nuts and avocados and olive oil now have all been redeemed. They're good for us. And in this study, they actually had 3 groups. They had a control group that they said to eat the low-fat diet. They did the worst. Low-fat diet needs to go out the window. It is not a good diet. I was surprised they actually were able to get it through their institutional review board, human subjects. Then they had one group they supplemented with olive oil, and another group they supplemented with nuts. It was walnuts, hazelnuts, and almonds. And the group that got the extra olive oil, 4 tablespoons or more a day, the group that got the extra nuts, actually had 30 to 40% less stroke, less heart disease. And so this is wonderful news because it's a really pleasurable diet.
Well, that's a good segue to say if I were your house guest for a week,
Yes.
all right, what would the menu be like at Dr. Mays' house?
Well, that's a great question. So, if you were coming, then I would want to make really wonderful wild Alaskan salmon and grilled vegetables.
No, I'm actually very serious because a lot of people are going to watch these videos and they're thinking, okay, what would be a typical sort of diet during the week? What should I focus on?
Yes. Well, again, in the book I just wrote, Be Fruitful, I actually described a week's diet, each day a different set of meals. And you do want to be paying attention to your omega-3 fatty acids, so you're going to get that in fish, you're going to get it in eggs that have been, where the chickens have been fed flaxseed or algae. You want to be sure you eat lots of vegetables. Vegetables are probably the healthiest thing we could be eating, but not potatoes. Most Americans, it's potatoes that they're eating as their vegetable. That's not so healthy. But the cruciferous vegetables, broccoli and kale and Brussels sprouts and cauliflower, including these every day in your diet, they reduce the risk of breast cancer because of the way they alter the metabolism of estrogen to safer forms. You want to be eating some whole grains. Whole grains is not flour. It's really brown rice, it could be millet, it could be quinoa, but where the whole grain is intact. You want to be including nuts. We know this from the study you just mentioned in the New England Journal of Medicine. They're very satisfying, they're delicious to eat, and so those are the kinds of foods you'd see a lot of at my house.
Okay, well, that's fabulous. Lisa, back to you for a second.
Yeah, I just want to jump in here. So when you're talking about the veggies and with this diet, and does it matter if they're raw or if they're cooked? And
Yeah.
is spinach included in this?
Yes. So, there's a lot of interest right now in raw food diets. It turns out that a lot of vegetables and fruits are actually more bioavailable, which means the healthful phytonutrients, whether it's anthocyanins or polyphenols or the healthful chemicals that are in those vegetables and fruits become more available when we cook them. Now, this doesn't mean that we want to boil them for an hour in water, because then all of the nutrients end up in the boiling water and not in the vegetable itself. But steaming them lightly or broiling, a lot of people like to roast vegetables. This is going to often make it more bioavailable. It's also easier to digest often for people than raw vegetables. So I think it's fine to eat salads. From an Ayurvedic or traditional Chinese medicine perspective, you might eat more cooked foods when it's cold. You might eat more cooked foods if you're not feeling well. When you're sick, often having broths and cooked vegetables are going to be much easier on your system. But I live in Tucson. When it's 100 degrees in the summer, a raw vegetable salad is perfect.
What about stir fry, Victoria? Does stir fry with the right oils, is that a good way to cook things?
Absolutely. So stir fry, because you're not overcooking the vegetables. The main important thing there is to not get that oil smoking. When you bring oil to its smoke point, you're creating abnormal and unhealthy by.
Hello?
Hello? Did we just, oh,
Oh, I think we just lost Dr. Mays.
I hope she's going to come back.
Wow.
Oh, darn it. Well, for the viewers who are watching this, we'll see if we can get her back. But are you there, Dr. Mazes?
I am back. I lost you for a little while.
Okay, you
All
were
right,
talking. Go ahead, Dr. Harness.
Yeah, Victoria, we lost you right at a key moment with the stir fry smoke.
Yes. Yes. Well, what I was saying is you really don't want to be using a cooking oil that gets to smoke point, because it creates unhealthy chemicals that you don't want to inhale and that you don't want to eat afterwards.
Can I jump in here? Okay,
Yeah,
we're talking about that Mediterranean diet, and we're talking about the olive oil. Now, I was under the impression that you can cook with olive oil, but that there are, like you said, there's certain oils that you can cook at a higher heat
Right.
versus a lower heat. So,
Right.
and my husband's Sicilian, so I mean, what can I say? I mean, olive oil is in everything.
Right.
But there are times where all of a sudden I'll be looking and, he's throwing in the garlic and I'm seeing it come to a boil. Now, I mean, it's not smoking, but, where's your fine line there? And should we be switching oils for something like that?
Well, there's two ways to deal with that. One is to choose an oil with a different smoke point. Olive oil has a relatively low one. But the other is to add some broth or some wine or some kind of liquid that is then going to allow the mixture of the oil and the broth to, not get to that boiling point and that smoke point at too low a temperature.
Keep it healthy.
Yes.
Can I jump in here again, Dr. Harness? I want to ask quickly, if everybody has time, when we're talking about the supplements, okay, of what kind of supplements do you suggest? I know we've talked about omega and the B12 and things like that, but and I've learned too, obviously, just these last couple of years, there's a difference when you go and you buy a synthetic supplement versus a whole food supplement. And if there is a viewer watching who may be going through chemo, that it's important that they tell their oncologist certain supplements that they're taking, like a kava, for example,
Right.
because that can have some effects while you're going through that. Am I off point here?
Well, I think supplements really need to be individualized. There is still a lot of concern about combining antioxidants with radiation because radiation works through creating these free radicals that the antioxidants and the vitamins would sort of scavenge. And so we are very concerned about with radiation. Many kinds of chemotherapy used in breast cancer also work through that mechanism, but not all. For example, the hormonal therapies don't work through that mechanism. And so it's really important to have that conversation either with your physician or with a pharmacist who really understands how the medicines are working and whether or not it's safe for you to be taking supplements at the time of treatment. When you're done with treatment, I'm not a very big supplement person. I think people should eat whole, healthy food, but sometimes it can be very beneficial. You mentioned kava. Kava is an herb that comes from the South Pacific. It's used to help reduce anxiety. There are other choices as well. Often people are very anxious as they're going through treatment. And there can be a great value, instead of having to add more pharmaceutical medicines, to be able to use some of these things. So, for example, I've taken kava during times of stress. There's one I really like. It's a tea. It's called Stress Relief. And it's a kava tea. And you brew it as a tea. You let the tea bag soak for 5 minutes, and then you drink it. It's very relaxing. It may help you sleep. So there are many things that can be used to help reduce the side effects that women may struggle with as they're being treated for breast cancer. It is a bit of an individual person by person set of decisions, as opposed to, well, everyone should be doing X.
Mm. Okay.
Oh, very good. Outstanding. Well, Victoria, listen, this is the second time we've had you here at Breast Cancer Answers. I feel like I just want to bottle you and distribute you all over the world, frankly. I mean, it's just amazing. And we would like to not only thank you for being with us today, but we would look forward to other opportunities in the future to not only collaborate with you, but to have you share your words of wisdom. They're just absolutely fantastic.
Thank you so much. It's a pleasure to be on your show.
Oh, you bet.
And
Lisa?
Dr. Mazes and Dr. Harns. First of all, Dr. Mazes, again, I can only say thank you so much for coming on. And I'd like to invite our viewers that if they have questions for us, we are open to taking as many questions as possible. Send them to us. And then, like Dr. Harns said, we'd love to have you back. And we would go through some of those questions that are sent in, because your information is so important. And, it's all part of this big puzzle of going through this. So we appreciate it. And the viewers, just send those questions in to breastcanceranswers.com. And I thank both of you for your time today.
Thank you.
Thank you.
Okay, everybody, happy Friday. And we will be talking to you next Friday as we answer your questions and possibly have another medical expert right here on Breast Cancer Answers. See you later.